This is the month of September, Ovarian Cancer Awareness Month, 2018. I'm so thrilled to be here with my honored guests today, and we're going to talk about ovarian cancer. My name is Sanaz Memarzadeh. I'm a professor of obstetrics and gynecology and a gynecologic cancer surgeon. And I'm accompanied today by my dear friend, Donna Richards, who is an ovarian cancer survivor and also a patient at UCLA, and Robin Babbini, who is the president and founder of the Ovarian Cancer Circle, inspired by Robin Babbini. Today we're going to talk about ovarian cancer. As a physician, I am a surgeon and I take care of women who present to our clinics with ovarian cancer. I do their surgeries, but I'm also very fortunate to collaborate clinically and work with a multidisciplinary team. We work together, we work with medical oncologists, radiation oncologists, pathologists, radiologists, the best teams available at UCLA so that we can deliver the best care to each individual patient. And we try our best to individualize care of these patients because no two people are the same, and that is very important. But in addition to performing clinical care and operating, I'm very fortunate and lucky to have a research lab. And in this research lab, we are focusing we're answering, trying to address some of the very basic questions as it pertains to clinical challenges in ovarian cancer. One of the areas that I was always struck by as a physician is the fact that ovarian cancer often relapses despite the fact that we treat patients with surgery and also with chemotherapy. This is a problem. We need to figure out why. So by studying the cancer at a very molecular level, we're starting to tackle why is it that this is the case, and can we come up with therapeutic interventions that can help alleviate this problem. We're very fortunate at UCLA to work with some incredibly smart scientists, and through these collaborative efforts, working with other scientists, people from outside of the field of ovarian cancer research, we're able to bring in new ideas to the table, and we hope to come up with better treatment strategies, some of which we're actually testing right now and we're very excited about. And we want to see that through these kinds of approaches, can we help improve outcomes of women diagnosed with ovarian cancer? So to tackle this problem, we need a great group of scientists. We also need funding. And it's been wonderful having this collaboration with the Ovarian Cancer Circle, inspired by Robin Babbini. Paulinda and her team have been instrumental in supporting our work. We've had this amazing collaboration for the past 8 years together. And I'm very, very, very grateful for all of your support. And through Paulinda's organization, I've also taken care of some patients, including Donna Richards, who came to me. A lot of times, patients who come to UCLA they're just newly diagnosed with ovarian cancer. Sometimes we also see patients who are treated at other institutions, but then want to come to UCLA and get a different perspective on the treatment strategy. Donna, I think you were one of those patients.
Yes,
we'd love to hear your story.
Yes, absolutely. I was diagnosed in 2012 and had surgery at a hospital here in Los Angeles and put together with a team of oncologists in the San Fernando Valley, and they were fine doctors. But unfortunately, I am one of the patients that my ovarian cancer was platinum resistant. We didn't know that at the time. So after 6 months of intense chemotherapy, the cancer had returned. It really never went into remission because it didn't work. So I was in trouble, needless to say. I stuck with the team for a little bit longer, and then when I heard the words, "We're not quite sure what to do with you, Donna," I realized I need a new team. I need more innovative thinking for this particular cancer because it's such an insidious disease to treat. And I, at that point, had become very educated about the statistics, and I didn't want to fall into those statistics. So because of finding out about the Ovarian Cancer Circle quite by accident, I reached out to Paulinda, and we spoke for a while, and she told me about, well, you need to come into the organization and learn more about what we do. And I said, well, where is all your funding going to? And she mentioned Dr. Memarzadeh's research lab at UCLA and how outstanding she was as a clinician, researcher, surgeon in this field. And I said, thank you, Jesus. That's where I need to go. And so fortunately, I spoke to Dr. Memarzadeh, and she was able to take on my case, which was pretty grim at the time. And this is back in 2014. And as Dr. Memarzadeh has told everyone here today, they have many levels of teamwork. And believe me, this is a team. I call them my three superheroes, and rightfully so, because she took the case on very personally, but she knew that this is not a one-man show or a one-woman doctor show. You need the collaboration of many, many brilliant minds, and many of them are at UCLA. And so she put me in touch with one of her doctor associates, Dr. Konecki, who is an oncologist here at UCLA, brilliant, caring, wonderful man. And he, with Dr. Memarzadeh, took over my personal profile of my ovarian cancer. So the teams that they have to combat this cancer at UCLA are very personalized for the patient. That's my experience. That's the most important aspect of why I will never go to another institution. They have literally saved me because I have had the cancer reoccur 3 different times, which is not uncommon because 70% of the women that get this disease, it comes back again. And it could come back in 2 years, 5 years, 10 years, 6 months. In my case, over a period of time, it has reoccurred. In addition, I had the fortune of having Dr. Memarzadeh and Dr. Konecki have many tumor board meetings just for me. This, as a patient, is an unbelievable experience to know that you have these magnificent doctors in a room with my slides, my CAT scans, PET scans, MRIs, looking at my personal life. How do we help Donna Richard? And because of collaboration among these scientists, they decide, she already tried that drug, it didn't work. She tried that one, it didn't work. I think we need to go in this direction. And they collaborate and they get back to you and they say, they always give you hope. That's the number one thing. And that was the first time after meeting Dr. Memarzadeh and Dr. Konecki, my husband and I walked out of the office for the very first time. And he said, you have a shot with these doctors. You have the hope that you've been searching for. And the hope has never diminished. And even though I have had the cancer reoccur 3 times, I've always had hope that if it came back again, they'll get it again. Because that's what they do. Her research, Dr. Memarzadeh's research, and the research from Dr. Konecki, and also another doctor that I have to give due respect to, because when they realized the drugs that they had available for patients like myself weren't working, and what do we do now? They said, well, maybe it's time to see Dr. Mitchell Kamraver. Dr. Mitchell Kamraver was with UCLA for quite a while, and he treated me with radiation with a very magnificent machine that there's only 5 in the country, and UCLA, thankfully, is one of the institutions that has this machine. It's called ViewRay, and it's a targeted radiation therapy. Well, that therapy of 10 treatments saved my life. So what I would like to kind of elaborate today on is that this doctor, my friend, my physician, and the other 2 doctors that I've mentioned, and the circle, because of being with the circle, finding Dr. Memarzadeh, it is a true circle of hope. There's no doubt about that. And it is my privilege to be a member of the circle. It is my deep gratitude that I have for Dr. Memarzadeh to be my doctor. I have the best team at UCLA, without a shadow of a doubt. So I'm thrilled to be here today to share this information with women out there. This is not a one-size-fits-all kind of thing. These are not stretch pants that you put on and it's one size. Your disease, your ovarian cancer, is a very insidious type of cancer to treat. It's very complex. And unless you have a team of doctors that are truly innovative and forward-thinking and researching all the time to gather the information, not just through UCLA, but, the Mayo Clinic or City of Hope or NYU or wherever the information is coming out of. They utilize that and they put a plan together for you. A lot has to do with luck. Do you respond? But I feel more than anything that it has to do with the people that are taking care of you, the physicians that are taking care of you, and the personalized care that you can call them at any time, day or night. Dr. Memarzadeh called me back on a 4th of July weekend one time, about a year or two ago, because I sent her an email. I didn't expect to hear from her until several days later, but she was concerned. And I just had a scare a couple of weeks ago. As you remember, I was finding symptoms that were very bizarre. I was very concerned that maybe things were happening again that shouldn't be happening. And she saw me immediately. We did a CAT scan, and fortunately, thankfully, everything was okay. But that's the kind of relationship you have with these doctors here at UCLA. That's the kind of relationship I am blessed to have as a patient. So I think the Circle has been my other lifesaver and anchor. I've become great friends with Paulinda since joining the Circle about 4 years ago, because it's the knowledge and the support that we get from raising funds, raising awareness, educating other women, that the Circle has given me a platform. I do call to action. I do speeches that resonate hope, because you have to have hope. Because if you read the statistics and you buy into the statistics, you're done. I really shouldn't be here if the statistics really are true across the board, because typically a lot of women don't last beyond 5 years. And then I've met people that have survived this ovarian cancer for 12 years, 15 years, 6 years, 7 years. So I plan to stay with this team until there's no other reason to stay with them. Maybe this will go in remission for the next 20 years. That would be a blessing. But all I know is that if I'm in trouble again, I have my team to back me up. So I'd like to kind of turn this over to my friend, Paulinda, who has been there for me in many dark hours of not doing too well, and cheering me on and sending me flowers and giving me hope. She's been very inspirational, and her inspiration comes from her daughter, who she'll tell you all about. So Paulinda?
First, I want to say that was an amazing story, and it reaches my heart. When I first met Donna and she told me her story, we were on the phone for 4 hours, and she was explaining all that had gone on, and my heart ached for her, and I was so anxious to have her meet Dr. Memarzadeh, because I knew that Dr. Memarzadeh could save her life and make a big difference in her life, and she has. And I'm truly grateful to know Dr. Memarzadeh, and I founded the organization, the Ovarian Cancer Circle, inspired by Robin Babbini, to honor the memory of my daughter, Robin, who was diagnosed at 17 with ovarian cancer. And our family didn't have any education in ovarian cancer and weren't aware of the symptoms. And for a whole year, she complained that she didn't feel well. She would be nauseous. She would have back pain. She would eat a few bites and say she is full. These are all symptoms of ovarian cancer, which we had no knowledge of. The gynecologist that examined her also didn't put on his radar that a young woman could have ovarian cancer. And he didn't offer her a transvaginal ultrasound, which is one procedure that a woman can ask for to see if her abnormalities are concerning. And there's a CA-125, which is a blood test. It's a blood biomarker. That's another way to detect if you might have ovarian cancer. I didn't know anything about any of these. By the time Robin was diagnosed, she had stage 3 ovarian cancer. And her story, she was very active in school. She finished her chemotherapy. She started UC Santa Barbara. She was able to pledge a sorority, a national sorority, Kappa Kappa Gamma. And unfortunately, in her case, the ovarian cancer came back 6 months after she was completing her treatment. Again, another surgery. It had metastasized through her intestines. And her doctor, we unfortunately were not UCLA, and I regret that. I wish we had been. He had told us Robin is chronic and that she will always have ovarian cancer, and we will just do the best we can to treat it with different chemos and so forth. And she didn't do well, and 8 months after that, she passed away. She was only 20. So 2.5 years after her diagnosis, she lost her life. So it broke my heart, obviously, and I made it my mission to educate, because our story shouldn't happen to other women. So I founded the Ovarian Cancer Circle, inspired by Robin Babbini, to educate people and keep Robin's legacy alive, because it was important, and we go and she shines a light on everything that we do. I give out bookmarks that talk about the symptoms. I give them out all the time. We do health fairs, we do fundraising. I speak in front of various groups. I actually go to her school, UCSB, and I speak in front of her Kappa Kappa Gamma friends and educate them. So it's my mission. I'm dedicated. I will do this for the rest of my life, because I don't want to hear any more Robin stories. And I also would like to say we do a lot of fundraising, and all our funding goes to Dr. Memarzadeh's lab, the Geodiscovery Lab. We have tremendous faith in her. She has made tremendous strides. She saves women's lives. I am honored to know her. It's been my pleasure.
It's my honor. Thank you.
And I also want to just mention that we do have a fundraiser coming up, and it's called Take a Bite Out of Ovarian Cancer. It's at Ruth's Chris Steakhouse in Woodland Hills. Dr. Memarzadeh is our honorary speaker. She'll be speaking there. And of course, anyone is welcome to come. We have a website, and you can purchase tickets on our website. We also have beautiful items that we sell, all for a donation, all to raise money for ovarian cancer and for Dr. Memarzadeh's lab. So my heart
Thank you,
reaches out to you.
Thank you.
I'm so proud of Donna. Donna worked so hard for the circle. We have raised in the 8 years that we have been with Dr. Memarzadeh over $500,000. So, and we will continue to raise money.
We're not done yet. We have a lot more work to do. One of the things I'd like to interject is, because of the circle and the support of Dr. Memarzadeh always being there for us when we need her to speak, and kind of gather the troops together so that the guests that sponsor our events have a firsthand knowledge. Who is this Dr. Memarzadeh? What is she all about? And they get to meet her and they get to ask questions. And she's always personable and forthright and giving of herself and her time. We get the opportunity at the circle to come up with out-of-the-box ideas of what to do to raise more awareness. And the more out of the box it is for me, the more I like it. And then I have to convince the founder here, who's a little bit more traditional, what do you want to do now? So I say with pride that we have a great team. We're all volunteers at the organization.
Right.
None of us get paid to do this. You can't pay us enough to do this. This is my mission as well now, to stay alive, to keep the education going, to keep the awareness going, and to keep the circle's momentum going in a direction that people can relate to us. You don't have to be a member of our organization to get involved. You can donate in honor of someone, in memory of someone, but research costs money, a lot of money. And unless we gather a lot of people to become as aware as it is out there in breast cancer awareness and education and funding, which is tremendous and it's very important. Unfortunately, ovarian cancer has been on the back burner for far too long. And when you start finding out all the details about the statistics and, you know, where we are today, we're not where we should be. I think you would agree as well.
100% correct.
And so we need to get where we need to be. And that takes a doctor like a Dr. Memarzadeh and her team at UCLA that continuously, I mean, she devoted her whole life to this. Mm-hmm. And we know that. We're lighting up City Hall on September 25th in the color teal, because teal is the color for ovarian cancer. West Los Angeles.
Right. We're also lighting up the city of West Hollywood.
Right.
Also designated September 17th, Ovarian Cancer Awareness Day, and they're lighting City Hall in honor of Ovarian Cancer Awareness Month. So
this is a team effort.
Exactly.
Really, this
Right.
is a team effort.
I would like to also say Dr. Memarzadeh honored us with speaking at our fundraiser last year to a group of 200 women. And it would the education that she gave at that luncheon was amazing. Women walked out of there with a tremendous amount of information. They had no idea, and we got so much praise for it and raised a lot of money because of that fantastic presentation.
Absolutely.
Thank you.
Absolutely.
Thank you.
Yeah.
It really takes a team, and it's about us. It's about women, and we have to do this. So
Yes,
that's
we do.
why we want to talk about ovarian cancer. The more we talk about ovarian cancer, the more we have a dialogue about this. What you're doing about raising awareness about the signs and symptoms, I'm often struck by how few women actually know about this. We don't have good screening strategies for ovarian cancer, but also the signs and symptoms, as Paulinda mentioned, can be very nonspecific. So women like Robin's story may have these signs and symptoms, but it's not thought that this is ovarian cancer. If this message reaches one more woman who has these symptoms and she presents to her doctor and gets care for this, this is an important cause. So we need to talk about this. The other issue is that this is a cancer that affects the reproductive organs. And a lot of times women are hesitant to talk about it, but we do need to talk about it. We need to raise awareness. We need to improve care. We need to do multidisciplinary clinical care, research, and I think through this collaboration, all of us together,
We
the
can make a
patients, the
difference.
community, the physicians, the researchers, this is how we can make a difference, and this is our mission at UCLA, and I hope that we can achieve this goal.
I hope so too. I believe you will.
I believe so too.
And the thing that I'd like to interject about my own personal experience was that I was somewhat knowledgeable about ovarian cancer. And I was past the reproductive stage kind of thing. I was already in menopause. And so when the symptoms very quietly, that bloating came about, the doctor was at the time that I was under his care said, oh, you're getting older and it's probably a condition of menopause and all of that. And I was tracked with this doctor for many, many years with ovarian cysts and things like that. So I had some red flags. So the message that, without going into too much detail about my past life and why I became a patient of ovarian cancer, is that you have to be your own advocate. If you feel that you have symptoms that are just not right, you demand certain tests.
Can I mention one thing as well?
Absolutely.
So I also want to mention that a Pap test is not for ovarian cancer. A Pap test is for cervical cancer. Many women say to me all the time, well, I get my Pap. It has nothing to do with ovarian cancer. And
Well, one of the other things which you taught me is that in ovarian cancer, many times it's really not beginning in the ovaries, it's beginning in the fallopian tubes,
That's
which
right.
you educated me on that. And that's where my cancer actually began. It began in the fallopian tubes, and it was from a miscarriage many years ago, which went astray, not getting the right antibiotics after the DNC from a miscarriage I should have been under antibiotics. And so it caused disease into the fallopian tubes, and it became a cesspool. And even though I had many outstanding doctors tracking me along the way, no one said to me, Donna, if I were you, I'd get everything out. Right? At that point, they were worried about, well, how am I going to become pregnant? Well, that was the least thing on my mind at the time. But if I had been told, this is a bad situation, get everything out, probably I would not be sitting here in this room tonight.
So Donna, you raise an important point that because there are no good screening strategies, tools to this day for ovarian cancer, we actually recommend that women who have family history or women who have family history of cancer get genetic testing. And now genetic testing is more and more readily available. And if a woman gets genetic testing and carries a gene and it's known that she's at higher risk for ovarian tubal cancer, she has the option of having preventive surgery. And that preventive surgery can actually be life-saving. And this is an important message that we'd like to get.
Had I had that, that my life would have been saved right then and there. I would not have gotten ovarian cancer.
That is a very good point, because nowadays people are becoming educated on the BRCA gene, and there is genetic testing available, and that can be preventive. And if you find out you do have the BRCA and you get the testing, there's a procedure you can do to save your life.
There's so many components to this, and it really comes from education. And if you are in the awareness, education, and this is part of the doctor's role, exactly, and the role that we have taken on at the Circle to educate as many people as possible. And if there's questions, to seek out the answers. Just don't say, "Oh, it's no big deal. I probably gained, a few pounds because I'm eating too much or I don't have enough physical activity." No, and in fact, the CA-125. That's not really all the time an adequate test, because 50% of the time it's a false negative or a false positive. In my case, I can't tell you how many CA-125 tests I had and never went above the number 9 or 11, which is nothing.
Even Robin's was very low. So.
Yeah, so that was a false positive.
Right.
That false negative, excuse me. And so it's not an indication for a lot of women that you're in trouble, so to speak.
So it's important to look at the patient as a whole, not just one number, but include the number, the physical exam, the imaging, as you mentioned earlier, and like Donna mentioned, being really aware of your body, being in tune with signs and symptoms. If any of those things, symptoms that Paula mentioned, bloating, getting full too quickly. Sometimes women come in and say that their pants are not fitting and they think that they just gained weight, whereas one of the signs of ovarian cancer can be fluid accumulation in the abdomen, and so the abdomen can become distended. Changes in the bowel and bladder function that are just not the normal for a woman and are persistent for days on and on and on. Those should be signs to get in to see your gynecologist or your primary care physician. And I know that the team at UCLA is very, very vigilant about working patients up very carefully, very quickly, and getting the patients into the right specialist so that they can get the medical attention that they need. That's
why UCLA is such a fabulous hospital, and Dr. Memarzadeh is such a fabulous gynecologic oncologist, because she knows what's going on. She knows how to proceed with the proper treatments. Many doctors don't know, and they just tell you, let's wait and see what happens.
Yeah, that waiting and seeing could cost you your life, because you don't know if it's going from stage 1 to stage 2.
Right.
And worse.
When women call me up and tell me that the symptoms, and I do get phone calls quite a bit, and people scared, and I tell them, go see a gynecologic oncologist like Dr. Memarzadeh. Don't waste time with a urologist or gastrointestinal. Go for the gynecologic oncologist and at least get ovarian cancer off the table if it's not going to be one of your diseases that you have.
Great discussion. Thank you so much.
I'm honored to know this was a privilege to be here with you.
It's a privilege to work with you ladies. I mean, your story is incredible. You're gonna
make me cry. She's gonna make me cry.
You are an amazing woman, and you're so brave and so passionate.
Thank you.
And it's wonderful.
Thank you.
And Paulinda, the fact that you have made it your mission in life.
Right.
Most people would have just wanted to forget about this and not talk about it.
Right.
You are an incredible woman.
Robin was an incredible person.
I can see where she got it from.
She's right here with me.
Yeah. I believe it. She's with us all.
In my spirit, and she takes care of everything that I say. And she's my force, and she's my motivation, and that's why I'm doing what I'm doing in Robin's memory.
Thank you for what you're doing.
And thank you for what you're doing.
We're a good team.
Well, we're a good team, and we're not going anywhere. We're going to keep working forward to get all the things, all the goals accomplished.
We need that early detection test, which does not exist at this time, and funding would be the ultimate goal for us, so we can have this early detection test, so women's lives could be saved, like a mammogram. or colonoscopy.
Right.
If you go
Preventiveness.
you go to your doctor, your gynecologist. Part of your examination is an ovarian cancer screening test. Boom.
Yeah.
You know, it would save millions of lives. So funding is the key. Research is important.
So I'd like to thank Donna Richards for being here with us today.
My pleasure.
Thank you so much for your time and all your amazing efforts. And I'd like to thank Paula Babbini for all the amazing
It's
work
my honor
that you do.
to know you
It's our
and
honor
to raise money
work
for
with
your
you.
lab.
It's our honor to
We're a
work
good
with
team.
all of you. And I'd like to thank every single one of you who you were here with us today. We appreciate your time. I hope you found this program informative. I'd like to send a message to women that be aware of your body. If you have any of the signs and symptoms that we talked about today, please seek care, see your doctors. If there's a woman out there who's diagnosed with ovarian cancer, know that there is hope. Seek care at an institution with expertise in taking care of your disease. And we at UCLA are happy to take care of you. Hope you have a wonderful day.
Thank you.
Thank you.